Yeah.
Thank you so much.
You're welcome.
I'm getting breast augmentation and a long time, like maybe 15, 20 years I've wanted to do it. To have my reflection in the mirror look like what's going on up here. Yeah. He is pretty well known in like the trans femme community, like Reddit and message boards and stuff. So and then yeah, his marketing campaign is like bar none. So unless someone is as transparent as like Dr. Barrett and this office is, I would go the other direction. I was really surprised in like looking or talking to other doctors like how opaque a lot of the process was. And here everything from beginning to end was completely transparent. I didn't know what was going on.
Beautiful patient. She is 39 years old, about to turn 40. We're going to do a major transformation for her today. She's been on hormones for over 10 years and she has some breast tissue, which is good, but you can see that this base width is pretty narrow, doesn't match the rest of the body. So today we're going to do an augmentation for her to get her to the look and size that she's trying to achieve. We're going to do it all through border of the areola incision. We're going to do our extended anatomic release for all of our most of our trans breast augmentations that allows us to have that soft coverage on the top so that it doesn't look fake and round. So I want to show you guys how we're going to inject numbing medicine on our patient so that she's not going to feel, her spinal cord, her body's not going to feel the trauma on the operation, okay? So even though it's not that traumatic, we want to limit that. We go in the border where the incision is going to be, okay? And we also do a rib block down here. We go slightly into the side. We don't want to go past the ribs here because that will cause a lung problem. And then lastly, we get the medial perforators up here. Just like that. And now, all of the breast is numbed up. We're going to put more numbing medicine inside so our patient wakes up pain-free from a breast augmentation. Now we're about to make our incision. All right, we're important to get that numbing medicine set before we make our incision so the body doesn't feel the trauma of the operation. That's the key to a rapid recovery. So making a border of the areola incision. This is the best place to do a trans breast augmentation because it's the least concealable, all right, and less problematic with bottoming out. All right, so we have a 450 sizer over here. We don't have anything over here. You can see it's making a huge difference already. Now, obviously, this is going to take a long time to drop and settle, but already you can see the difference. No implant, implant. All right, this is kind of intense. You can see on a trans breast augmentation, they're always going to look really crazy at first. We're sitting her up on the table to make sure that it looks exactly how we want it to look before we pick this permanent size. I think we're maxed out in terms of what we can do in terms of sizing. So this is 450 both sides. All right, so I think that's what we're going to go with today, but you always want to make sure the doctor sits you up on the table to make sure that it looks exactly how you want it. We have the implant in the Keller funnel. This reduces capsular contracture, makes this whole process smooth. People shouldn't be using their fingers to stuff an implant in anymore, guys. All right, here we go. Voila. Here's a beautiful breast. Smooth as can be. that's it for our beautiful trans breast augmentation. Quick recap, I want to go over a couple key steps that make a trans breast augmentation different than a cis augmentation in recap here, okay? So we did our sizing for her, all right? Our goal size was over here. We did 440. That was the largest that we could do on the table for the breast to handle. Okay, remember the breast was going from basically 0 to 60 in a couple hours. A normal breast development for someone who has breasts that gradually improve over many years has a lot of time for that skin to stretch out, okay? So we had to be very careful with that. That was the largest we can do. It's gonna get very close to this. We did our extended muscle release that allows us to go underneath the muscle. A lot of people put the implant above the muscle and it looks super fake, all right? Because trans breast augmentations, you wanna have that teardrop shape on the top, because if you do go above the muscle, they tend to slide down, okay? So a lot of surgeons, if they go above the muscle, you're gonna see that happen, all right? It's better to go underneath the muscle with this extended muscle release. Border the areola incision to conceal that much better. If you wear a bikini and you have a line underneath, you raise your arms up, you can see that line underneath. Not only that, but it disrupts the bottom support mechanism of the breast so that the implant can drop down and you can see bottoming out. You'll see that some people, their nipples start to point up toward the ceiling. You wanna avoid that, all right? So that's it. If you guys have questions about trans breast augmentation, leave them right down here on my YouTube page. Don't forget to give me a thumbs up. And if you wanna see more videos like this, please hit the subscribe button. And also, if you wanna have more information about trans breast augmentation, if this is something that you're considering, check out my website, transbreastaugmentation.com. You can also reach out and DM me on social media at Dr. Daniel Barrett.
I'm okay, but
Good.
very sore. Yeah.
Have you seen them yet?
I did. I started crying.
Yeah.
Yeah, thank
Let's
you.
take a quick look here. All right, very tight.
Very.
It's exactly how it's supposed to look though, okay? So it's gorgeous. We did 440 cc's.
Can I hold your hand up?
Sure, yeah.
Thank you so much.
You're welcome. My pleasure.
Thank you.
My pleasure. You're gonna look so good. You'll feel better by tomorrow.
I appreciate you so much.
My pleasure. You're welcome.
I think multiple times a day, like I'll get up to do my little laps around the house because Dr. Barrett asked me to go for little walks, you know, and shake my legs out. But I'll like stop and look in the mirror, and I'll either lift up my tank top and I'll look, and then it's the only way I can describe it is like my brain kind of just goes, yeah, this is okay. Like, whereas normally before the surgery I would look and I would always, there's like a lack, or my brain would go like, something's out of line or incongruent here. And so there's kind of been a getting used to that, of my brain seeing my body and going like, oh, this is fine. There's nothing wrong here. Yeah. So to just like take it day by day, and to like both listen to like, I think I've watched Dr. Barrett's video like 3 or 4 times in the last 3 or 4 days to like reference, oh, what should I do when something's come up? So yeah, listen to your doctor, and then listen to what your body's asking for, and just do it. Yeah.